You ready?
Yeah.
You sure?
Let's do it.
Hey everybody, Blake and Forrest from the AnKing team. We're really excited to be here working with AMBOSS. We are very grateful for all the questions that have been submitted, and we're excited to go ahead and address these, and hopefully it can be useful for some of you out there. So yeah, let's dive into our first question. All right, Zaid from Jordan asked, what is the best time to start doing Qbanks? Should you start early, even if you are not familiar with many topics?
I would start using practice questions as soon as you cover a topic in its entirety. So if you start a block of cardiology, and that's your first block in medical school, I wouldn't necessarily use a Qbank on cardiology when you're still in the middle of learning it. But after you finish cardiology, I would start to introduce daily small sets of practice questions to cover past material and practice past material. And then, but ideally, when you are several rotations or you are several blocks into medical school, you'll be able to mix together all of your past material into one small set of daily practice questions every day. For us, that was at the start of our second year of our 4-year medical school. We didn't do very many practice questions before that.
Yeah. What would you say for, I'm just kind of adding more to this question. I know there's a lot of schools that have curriculum that have exams every 2 weeks. And those exams actually count. They're not like practice ones or anything. And people want to be able to, do questions and prepare for those. What do you think AMBOSS has to offer to help you gear for those exams every 2 weeks?
Yeah, and I would say actually that this is one of the most unique aspects of AMBOSS that is superior to other question banks, is that you can actually narrow your question set down pretty well. So if you learned 2 weeks worth of cardiac anatomy, but you haven't gotten to the pathology yet, you could select cardiac anatomy in the practice question set, for example. And you could target your questions to that exam within 2 weeks. And that's often what we were able to do. So we would try to finish all of a certain set of practice questions right before a final exam, depending on the time of year, depending on the rotation, or depending on our block. We would focus in on a subset of practice questions in order to prepare for these shorter term exams.
Yeah, I think that's great.
All right, let's get the next question here.
Okay, what are you throwing at me?
This one is, this is an interesting one. I think at Shooby-Dooby-Doo. Okay. And they are asking, how do you balance doing questions and clinical work, especially when you have really long clerkship hours?
Okay, speaking of wards, we're going there. So I think that's a great question. And I think it's challenging, honestly. It's something that we all have to adapt to going into third year, is that you have to take what you did to learn, and to an extent, you kind of have to throw it away and start and learn a new way to learn. The reality is that clinical wards have long hours. You're going to be there from 6 a.m. to 4 to 6 p.m. most days. Yeah. And I think the good side of that is you learn from your patients. They should be your primary learning resource. You should be able to see a patient, and you see a patient on heart failure and you don't know anything about heart failure, and you learn how to take care of heart failure. You need to give them beta blockers and you learn all the drugs, ACE inhibitors, ARBs, all those. And then the next time you see a heart failure patient, hopefully you learned and you can take care of that patient without having to do the legwork to learn heart failure. But then you also have the issue of I still have to prepare for my shelf exam. And spoiler, shelf exams do not look like the clinic.
They're hard. They're harder than I thought they were going to be.
And they're not they don't look like a patient in the hospital. It's just the reality of the exam.
But a lot of the stuff you learn in the hospital, I feel like actually does carry over.
Totally applies. Yeah. I'm just saying does not look the same.
Yeah.
And that's where question banks come in. So I think what you do is you set a goal to do so many questions a day. That's what I did.
Yeah.
I said I was going to do, I had a 6-week internal medicine rotation. I needed to do 20 questions a day to have gone through most of the AMBOSS questions by the time I got to my shelf exam.
Yeah.
And then I felt like between learning from making mistakes on questions and from seeing my patients, I felt like that was sufficient to take my shelf exam and for my step 2 exam.
Yeah.
I don't know, would you add anything different? That's kind of what I would do.
Not really. I think the only tip I would add that worked really well for me was as long as I wasn't getting to the hospital at 6 a.m., if I was on family medicine or something, a little more outpatient with more reasonable hours, I would try and get up really early in the morning and do those 20 questions in the morning. Because like you mentioned in your question, the long clinical hours, it's hard after working 12 hours to come home and try and think and do practice questions. And so that's if you can do them in the morning, first thing in the morning, do that. And I in the first preclinical years, I always recommended, get up first thing, do your Anki reviews because you're doing 400, 500 or so.
Yeah.
In the clinical era, I would actually flip that. Do your Anki cards at night, do your practice questions in the morning when you have the energy and the stamina. And so you just kind of rearrange your schedule a little bit. Like Tyson said, I think I was only doing, 20, maybe 30 practice questions a day. And if you schedule it out and you're just pretty consistent doing things every day, it works.
Right. I feel like there's a lot more work in third year, but the volume of studying I did was less.
Yeah.
And so I think that makes up for some of the time, is that you learn from what you're doing all day.
Yeah, definitely.
And I would also say take advantage of downtime on the wards. I feel like there was lots of times where I was sitting in the team room and we didn't have any new admits and patients were taken care of. And do 3 questions if that's all you have time for before something comes up.
Yeah. Yep, I agree.
All right, the next question. This is on the topic of AMBOSS and AnKing together. So a question from @USMLEGoal K. Wait, why are you guys collaborating with AMBOSS? What are you guys working on?
Secrets. Why we collaborate with AMBOSS is mainly because we have similar goals. At AnKing, we really just want to improve the student experience through medical school. We want to eliminate the struggles and the kind of the craziness that we go through. And so AMBOSS has a similar goal. We've seen that AMBOSS really wants to innovate how medical education is done. They really want to streamline studying and make it easier for all of us. We personally all enjoyed the product a lot and felt like it was very useful in prepping for each of our exams, whether it was basic sciences, step 1, step 2, or, those shelf exams and such. And so our goals aligned, and it felt very natural for us to collaborate together. Some of the projects we've already worked on are the Anki add-on. We've done some other video series. We've worked on a tutorial course, like a crash course for Anki for AMBOSS users who want to get into using that. And we have a whole bunch of other projects kind of coming down the pipeline right now as well.
This question here, this is from Ronnie Lot 12. I'll be in M3 this July. What is your biggest piece of advice in the transition from preclinical to clinical education?
Well, first off, congrats. That's a big deal. Moving from preclinical to clinical curriculum is a huge change, and it's setting you up for the rest of your life. So genuinely congrats from all of us on our team. I get one piece of advice. Now you're putting me on the spot.
Only one.
Only one. Okay, I've got one. I think if I had one piece of advice, I'd say learn to be okay being wrong.
That's a good answer.
I think I was wrong more third year than any time in my life.
Yes.
But there's some biochemical, and Nick and I are both neuroscientists by training, so I'm going to get a little geek out of neuroscience here. But there's some dopamine release when you emotionally invest in something.
Yeah.
So when you commit to an answer, you attach emotion to it. And then you get a dopamine release, which is why you like committing to things. But that emotional response also enhances memory. Whether you're right or wrong, the fact that you attached emotion to a situation will make it more likely to remember. So whether I'm giving the patient the wrong med or the right med when I present my plan to my attending, I'm going to remember it better because I committed to something. And the sooner you get over the fear of being wrong and are more willing just to learn, the better off third year will be.
Yeah, I absolutely agree. That is such a good answer. And I'm going to flip
this back to you though. What's your one?
Well,
piece?
I tell people, whatever patient you're in charge of as a med student, there is an intern and an attending over you that's also taking care of that patient, right? My advice would be, and this kind of goes along with what yours would be, take that patient and treat them like every single thing you say you want to do as a med student, that's what's going to happen. If you say you want to start that patient on antibiotics, we're going to start them on antibiotics, and treat it like you are the only person making that call.
Yeah.
And so like you're saying, like commit, right? You got to make that commitment. That is so hard as a med student because you are going to be wrong, probably. Well,
more than you're right.
Yeah, more than 50% of the time. But I think that commitment is where you're going to learn, but you're also like, out of fear almost, you're going to do a lot of research because you're going to go to the attending and say, I think we should do this. And you want to say that with confidence, and you want to be like, this is why, because I did this research this morning that shows this. And if you really commit to that, even if you're dead wrong, you will have learned so much from that, and other people will be impressed from that. And so I think, accept that you're going to be wrong and understand that, but go into it making commitments.
Make a choice. Like, be wrong. It's okay. And so like, don't expect to be great at it overnight, but that would be my advice. It'd be okay being wrong.
Yeah, that is solid advice. I agree.
Thanks again, everyone, for sending in questions. We remind you that both AnKing and AMBOSS are dedicated to answering student questions and making sure you have all the resources necessary to succeed during medical school. We've been through the process. AMBOSS is intimately involved in medical student life and improving it. So we remind you that we have lots of resources at your fingertips to get more help.
Yeah, we're grateful for all of your support, and we wish you the best of luck.